Hi friends, welcome to Interactive Medicine. In this section, we can talk about the pharmacology of the central nervous system. In this section, we are only talking about the mechanism of anesthetics, and we are discussing about the drugs and its mechanism and the use and adverse effects of anxiolytics and hypnotics. It includes the barbiturates, benzodiazepines, and non-benzodiazepines drugs. So let's into a question first. Uh, Local anesthetic Novocaine, lidocaine, and others decreases pain sensitivity of tissues by blocking Na plus and K plus ions from permeating membranes of the nerve fibers and endings. Such mechanism of drug action is called ancillary membrane ionic. We know this answer, but we are going to discuss what's the mechanism behind here. Okay, we know the graph that okay, consider this is cells resting membrane potential. Okay, cells undergo depolarization due to Na plus influx, and cell undergo repolarization due to Ka plus efflux. Then it attains its normal position. So we have cell membrane. The cell is neural membrane, and there is channel for sodium. In at resting potential or resting, the channel is closed. So normally we can see outside the membrane we have positive, inside negative because of high amount of proteins inside there. And if a stimulus comes here, like for example pain, so Na plus F influx will happen, so high amount of positives here, and in outside it becomes negative. So this is how depolarization occur. So anesthetics works to block the sodium channel and block the depolarization. So let's look how it works. Once again I am going to drawing our neuron membrane. So we administer, for an example, Novocaine. This is our sodium channel. Okay, first this Novocaine goes into the inside the neuron, and it binds and it becomes protonated. And this drug is going to block the Na plus from inside, so Na plus can't enter. This is how local anesthetics achieve the analgesia. That's why we are talking membrane ionic. It's not there is no there is no participation of receptor here, no participation of enzyme here or anti-enzyme. There is no chemical reactions here to occur. This is the diagram. Local anesthetic mechanism. Drug is found first inside the cell, then become protonated, then blocking. So sodium can't enter into the cytoplasm of the neuron. So I'm going to tell about hypnotics and anxiety. So first I want to say about the anxiety. Anxiety is the condition, it's an emotional condition where patient is undergoing very fear or worrying or in panic situation. So some drugs are helpful for blocking this mechanism, and also many patients have who are suffering with insomnia. Insomnia is the condition which that the patient can't sleep very well. So in the night he is not sleeping well. So his because of the insomnia, his working is he can't work properly. He can't do anything he can't do anything very correctly. So there is so much problem because only due to insomnia. So we have some drugs which can cure for insomnia and anxiety. These are known as hypnotics or anxiolytics. So first I want to say the central nervous system inhibition, because the sleeping is achieved by first inhibition of the central nervous system. Central nervous system inhibition achieved by central nervous system inhibition achieved by a neurotransmitter known as GABA, or we can say gamma amino butyric acid. So this is an inhibitory neurotransmitter. So GABA, how is it work? GABA is going to work inhibit the excitation or in the synapse. So we have, this is presynaptic neuron. This is going to release GABA. This is our cell membrane, namely neuron. So neuron membrane, this is neuronal membrane. Okay, I already said that how is it action potential occur? Action potential occur due to the influx of sodium, and also and it leads to the high amount of positive charges inside the cell. Okay, GABA is going to open the channel for open an channel receptor. It acts on a receptor that known as GABA A receptor. It acts on a receptor known as GABA A receptor. It acts on a GABA A receptor, so it leads to increase the influx of chloride channel. So chloride ions. It leads to influx of chloride ions. So there is so many negative ions inside the cell. It leads to, so there is more difficult to excite to it becomes more difficult to make an action potential because there is much more sodium need to come inside to make a action potential. This is how the inhibition of central nervous system happen. And we talk about the limbic system. Limbic system, here we can see this is our limbic system and this is amygdala, one of the portion one of the main part in limbic system. It controls the anxiety or basic anxiety, like also basic emotions. So how it works in anxiety, when a person who gets become consider this is our amygdala have high number of GABA A receptor. GABA A receptor, and when during anxiety or in a fearful situation, amygdala send signal. Consider this is our neuron. Okay, this is our nerve. Okay, nerve is exciting impulses. It transmit impulse through excitatory neurotransmitter. Excitatory neurotransmitter. Okay, this is how anxiety works. So when a person at the situation of anxiety, amygdala send excitatory neurotransmitter, and it leads to many impulses transmission of anxiety and fear. So fear and anxiety is controlled by GABA. We have neuron here which can release GABA. So here the impulse is blocked. So this is amygdala. Okay, and this is control for basic emotion, anxiety and fear. Okay, when a person at the situation of fear and anxiety, the amygdala sends signals to the central nerves, to the brain through excitatory neurotransmitters like glutamine, and it transmission all the way. But we can control this anxiety. We have neurons which release GABA, and this GABA is going to block these impulses. So here is how anxiolytics works, or this is how our body is controlling against the anxiety. So we have, this is a GABA receptor. First I want to say about GABA receptor. So this is our neuronal membrane and GABA receptor. GABA receptor have subunits, namely alpha, beta, and gamma. Also delta, gamma and delta. In some case, in some receptors we have gamma, and some receptors we have delta. Okay, gamma, it's like this is alpha and beta. Okay, we have namely 2 alpha and 2 beta. We have 2 alpha, 2 alpha, 2 beta. Okay, why I am saying that? Because the gamma is going to work, the GABA is going to work here. The GABA have the binding site between alpha and beta. This is GABA is going to work. Okay, and the benzodiazepines between alpha and gamma. Benzodiazepine between alpha and gamma. And barbiturates either beta or alpha. Either beta or alpha barbiturates. These are the binding site. So benzodiazepines, barbiturates, or barbiturates, when they have binding site in here, so it not binding with the binding site of the GABA. It's just bind with the alpha or between the alpha and gamma, and it enhance the affinity of GABA A receptor towards the GABA. So it leads to chlorine influx. So the difference between benzodiazepines mechanism and barbiturates are benzodiazepines increase the frequency of chloride uh, chloride influx, and barbiturates increase the long time it takes, increase the duration, which means that the channel is going to be open more time of influx of chlorine. So barbiturates often causes depression, central nervous system depression. That's why most of the times we didn't prescribe barbiturates. So benzodiazepines we more preferring for treatment in a clinical practice. So this is draw. So we have alpha subunit, beta subunit, and the gamma subunit. The benzodiazepines have binding site between alpha and gamma, and GABA is binding with between the alpha and beta, and barbiturates either working bind with alpha or beta. So it leads to the chlorine influx. So I want to say that not only alpha, we have many subunits for alpha and beta, and if this is considered, this is the alpha subunit, and alpha subunit 1, we have many subtypes of alpha subunit, alpha 2 or 3. Okay. Yeah, I already said that GABA receptors are widely distributed all around the central nervous system, and mainly it is highly concentrated in amygdala. So if the GABA receptor have alpha with one subunit, it promote promote it promote hypnotic effect. Hypnotic effect, and if the GABA A receptor have subunit of alpha with 2 or 3, they have anxiolytic effect. So benzodiazepines include diazepam, nitrazepam, clorazepam, clozapam, clozapidem. Here I make a spelling mistake. Clozapidem. Clozapidem, lorazepidem, barbiturates, and I am going to say the use of benzodiazepines. It have sedative effect, hypnotic effect, anxiolytic effect, anti-convulsant. Like we have treatment for epilepsy or seizure. We can use benzodiazepine for epilepsy or seizure. It acts as muscle relaxant, property. So we can treatment for primary management for insomnia. Primary management for insomnia, and treatment for anxiety effects. Okay, antagonist of benzodiazepine receptors, flumazenil, because flumazenil have binding site between alpha and gamma, so it is the antagonist of benzodiazepine. So we can give treatment for benzodiazepine overdose. So mechanism of action of barbiturates of benzodiazepines. bind to GABA receptor at different allosteric sites, facilitates GABA action, barbiturates increase duration, benzodiazepines increase the frequency of opening of chloride channel, membrane hyperpolarization, central nervous system depression. At higher doses, barbiturates act as GABA mimetic. The adverse effect of benzodiazepines: drowsiness, addiction, ataxia, ataxia or clumsiness, fatigue, confusion. So next we are going to discuss use of barbiturates. It is the treatment for insomnia, phenobarbital for epilepsy, thiopentine for anesthesia, adjuvants in psychosomatic disorders, preoperative sedation, treatment of seizure disorder, treatment of jaundice by inducing synthesis of uridyl gluconate transferase. Barbiturates adverse effect. If we use in short term, we can show the symptoms of slurred speech, disorientation, confusion. If we use in long term, depression happen, addiction, coma or death will happen. After emotional upset of a woman has been suffering from disturbed sleep for several days, what soporific drug means? What uh, drug for sleep? Drug for sleep. Drug for sleep. Or hypnotic drug. Soporific drug means hypnotic drug would be preferable for this type of insomnia. So patient with emotion, both anxiety and no sleeping, we prescribe benzodiazepine. For example, nitrazepam. We are preferring, not prefer. If we have a benzodiazepine, we prefer uh, diazepine more than barbiturates. Chloral hydrate is we used for anticonvulsant. A patient has developed status epilepticus. Medicine should be used in the case of stopless seizure is diazepam. Jaundice treatment involves administration of barbiturates, inducing synthesis of glucuronide transferase. A medicine effect is caused by the production of direct reacting or direct conjugated bilirubin. This is asking inducing the synthesis of UDP glucuronide. What is its function? It conjugate. UDP glucuronide transferase uh, uh, unconjugated bilirubin converted into conjugated bilirubin by using UDP glucuronide transferase. Glucuronide transferase helps in the mechanism, helps in the reaction where the conversion of unconjugated bilirubin into conjugated bilirubin. So it can be excreted through urine and feces very easily. It becomes water soluble in this time. Non-benzodiazepine hypnotics acts on the alpha subunit. I already said in my class at the starting. Acts on alpha 1 subunit of GABA receptor used for only for insomnia. Alpha 1. If it is alpha 2 or 3, we can use anxiolytics. Anxiolytics. So these drugs solpidem, soficlone, salapalone, esopiclone acts on the alpha 1 subunit of GABA receptor. Memory loss, which means memory loss, adverse effect, memory loss, daytime sedation, impairment of motor function. What I mean that solpidum, it have, don't confuse, it's axon alpha only. What I mean that we have alpha 1 here, we have GABA here. Okay, these are the binding site of benzodiazepine and benzodiazepine like or non-benzodiazepine hypnotics. Benzodiazepine and non-benzodiazepine hypnotics work here. So solpidum, solpidum have the effect only in alpha 1 GABA binding site, not in alpha 2 or 3 with GABA. But benzodiazepine have work here. Benzodiazepine can work here, but solpidum can't work because it is alpha 2 or 3. Benzodiazepine works here with the action of anxiolytic. So it can enhance the affinity of GABA neurotransmitter and increase the frequency of core influx. So we will continue our central nervous system with another topic. So if you like this video, please make a thumbs up and share to your friends. If this video is too slow, just increase the running time. So I said in English very slowly because for understanding and it's easy to convey. And thank you friends, have a nice day.